friends and mimosas. Yeah, it's gonna be bubbly kind of time. Join new friends to relax and unwind. The best food with drinks on the side. Cheers to the good times. It's friends and mimosas.
Biology was my favorite subject in high school, and I think my father thought, okay, out of all these 5 boys, this will be the one that becomes a doctor. But no way. Too much of mom into me. I like to talk. I'd get a D in deportment in first grade. And there's no way I was ever going to pass organic chemistry, okay? But he saw that spark in me, and he would take me into the OR, and I would scrub in. I was in the full everything, and he let me see. I saw hysterectomies and appendectomies, and I saw vaginal births and C-sections, and I saw everything. And it was such a lesson. I mean, it really was a lesson. And I always joke that my father just wanted me to see an episiotomy at 15 or 16 because then I wasn't going to go on a date till I was postmenopausal. Oh, gross. That's what boys do to you? I'm not, you know. But he knew I just had this interest in science. But I'll tell you, and I'll probably get choked up on this story, I'll never forget on one of them, it was a woman who was a severe diabetic, and she was 8 months along, and they had to deliver by C-section the baby early because gestation diabetes, she would have died, the baby would have died. I mean, it was a dangerous situation. So, and my father was one of the top high-risk things. So I got to go in and see that, and I'll never forget this. I can see it like I'm looking at y'all right now. Baby was delivered. I remember the neonatal team coming in and suctioning and like working. And I remember the neonatologist, while my father and the other doctors were tending to the patient, the woman, I remember them saying, you know, we got to get to the whatever unit. I need more to work on this baby, because they knew the baby was, you know, in distress. Yeah. And every day, I mean, I was 16, okay? Every day, Father B would come home and I go, Dad, how's that little boy? I can see the mother, I can see the baby. How's that little boy? How's that little boy? And every day come over, he'd say, and he was from Mississippi, and he'd go, Meg, you know, the baby's in the neonate, you know, and they're working, you know. And I remember about 9 days later, he came home and said the baby didn't make it. Now,
I knew you were going to say that.
Okay. Now, you think a 16-year-old has a better lesson than that? I mean, you can't teach that. I saw that, and that shaped me. That shaped me, but it shaped me in a good way about the value of life, the value of what my father did, the value of health.
How did your mom feel about that?
Oh, that wasn't an issue to her. Oh, no. She was rebuilding the Cabildo when it burned, and she had a needlepoint store, and she was president of Friends of City Park. She was running every nonprofit, and that was her thing. But no, I assumed she thought it was great. And when I was in college in the summers, I'd come home, and my father had like a medical practice with other doctors, and I would work for the practice, you know, doing the grunt work, answering the phones and refiling and pulling the charts for the next day. And that taught me a lot too, I have to tell you. I was 18 years old, and my father walked through, and it was, you know, of course, no digital, you know, medical records, and it was like the catacombs, those big rooms with the drawers and the files, and the files had the little metal tabs, and you're trying to pull and put in your fingers. And he walked through once, and I was an 18-year-old pouting because, you know, this wasn't any fun. Please. And he looked at me and he said, "What's wrong?" And I, you know, this isn't any fun. They're making me do the, you know, of course all the receptionists were making me do the grunt work, you know. And he looked at me, and in his gentle Mississippi Southern gentleman, but firm, just from his eyes, he looked at me and he said, "So, do you want to make good grades in school and have a profession, or do you want to do this for the rest of your life?" I mean, you can't teach that, okay?
Yeah.
And he went about his work, and
Okay.
Oh yeah, message delivered.
Right, exactly.
To pouty little 18-year-old who wasn't with the sorority
Was
sisters
he,
having fun.
was he upset that you didn't go into the medical field?
I think they all, my parents were so wonderful. As one of my brothers said, Mother B and Father B handed us the ball on the half-yard line. And if the six of us couldn't punch it in the end zone a half yard, shame on us. Because other people get the ball way on the other side of the field of life. And so, no, they just wanted us to be happy and succeed and do what we wanted to do. So, and look what I'm doing. My original major was biology. My minor was theater because I wanted Barbra Streisand's job.
Oh, really? Did you do any
Please,
theatrical?
high school, please. Those people are athletes and, they're okay. But look what I'm doing. I ended up changing my major to print journalism and then stayed another year radio and television, a business minor. But I am performing and I'm using the medical for my health. You see how there was a whole thing in place.
Right.
But can I just say something about the brain? What to do with your brain. It is the #1 organ. Okay, think about it. I don't want to, but you can live without an arm or a breast. Okay, you can't without your brain. And if you just prevent brain things, of course there's congenital things, of course there are things you can. But the #1 way to prevent dementia is exercise. Exercise creates neurogenesis. What is that? Creation of new neurons, new brain cells. Exercise keeps the vessels from getting clogged. And a healthful diet, okay? Now one more thing, and I know we're going to get into this, but women in general have to be on their hormones, womb to tomb. And I am not a doctor. I'm not an MD. I didn't go to medical school. I am repeating.
I know. I've like so many conversations.
I'm repeating what my father, who was an expert in this, told me. So I am repeating that. Everyone has to talk with his womb to tomb. Okay?
Oh.
Womb, you had your hormones before you were born. Of course, they more at puberty. You need them until the day they cremate you or put you under the ground or whatever. Don't know because they were lied to, and I'll tell you why. But I also read the studies, and I also finally, what my father told me in the 90s, doctors now email me, we thought your father was nuts. But oh my God, did you see this latest study? He was right. He said all this, and all these things coming out, he told me back in the 90s. And he explained to me that the Women's Health Initiative study that made everyone scared and women threw their hormones down the drain and out the window and, oh, it's going to give you cancer. It was wrong. It was poorly done. We know that now, but here's the problem. Many doctors don't know that. And the media, my profession is just as much at fault. They're still quoting it, and they're still saying, well, this, but of course the WHI says it was a bad study. It was one size fits all. Never. You don't take every type 1 diabetic and say, boom, take this many milligrams of insulin once a day. You're done. No. Measure their blood. You see this person needs this much, this person needs this much, this person needs this much 3 times a day. Okay. It's hormones. Okay. So it was one size fits all. Never did my father do that. It was oral. My father never did oral. Why? Because your ovaries are not squirting your testosterone, estrogen, progesterone down your throat, through your gut, through your gallbladder enzymes, through your liver. No, they dump them right into your blood. And your brain's telling it, do this much. Oh, it's about time for a period, so lower this one, raise this one, right? It's all regulated. Well, now you have to do it by checking your blood, and you have to do it. It's not as good as your own body doing it.
So how do you take it if it's not filtered?
All right, so let me keep going. So he did anything that went straight to your blood. So he did patches. He did shot of the month club, he called it, injections. He did pellet implants. that just like your ovaries slowly release, but every woman had her own formula, and her formula is based on her blood test.
Okay,
Her
what
blood
happens
test.
if your doctor doesn't do blood
You
tests?
find
You find
When
a
the
different doctor.
I've been to two.
Again,
Okay, I've been to
again.
two, and they said we don't go by blood. That was the old way.
That
We don't
is
do
correct.
that. My
That is
doctor does
okay.
blood.
That is correct. Get another
They go
doctor.
by symptoms. They told me.
That
No.
okay. So here's what my father taught me.
How would I know what
You are not treating the symptoms. You are treating a deficit in your entire body. All of our bodies are different. Okay. If you don't have your estrogen, progesterone, and progesterone if you have a uterus, then all these things are happening in your body, in every cell. Less blood flow to your eyes. Your skin on your face is one of the biggest users of estrogen. Why? Because it's a sex organ. It's one of the first things that attract men when we go through puberty. Your skin is better. Your teeth are better. Your heart. Number one killer of women. Get into the brain. Remember, that's the main organ. Your heart. What's the number one killer? The number one killer of women, heart disease. Okay? Your vessels get clogged. What happens? What happens when you're a little girl? Your body's straight, your breasts are flat, your hips are flat. You go through puberty. What does estrogen do? Fat, breasts, waist, hips. Estrogen has a powerful effect. What happens when you take the estrogen away? Look at postmenopausal women not on their hormones. They have that big thing. Why is that worse than the typical fat that we all women have? Gain weight, breasts get big, hips, thighs get big. Because the weight around your waist, so waist to hip circumference, ratio rather, is what's important. It is called VAT, visceral abdominal tissue, okay? It is the bad fat wrapped around all your organs. It causes heart disease, it causes cancer. Most cancers are caused by inflammation in the body. It causes inflammation. It is the worst thing you can have, okay? Because your metabolism, which is a very, very complicated multi-system, multi-organ process, needs estrogen, progesterone, and testosterone to work right. And if it doesn't work right, you're going to be insulin resistant. What is insulin resistant? Pre-diabetes. What happens? You store fat. You can't lose weight. It stores around your tissues. And then the trickle-down effect of metabolic disease is, I can't even list them all right now, all the things that it causes. Now the brain, this is huge. So why are 2/3 of the people with Alzheimer's women? Because your hippocampus, where memory is, shrivels up without your estrogen. Less Parkinson's, less Alzheimer's, less MS, less dementia when your brain has the estrogen it needs. That's why women say, oh, brain fog, all that, depression. And so it was a lie to women that it caused cancer. The latest studies, 22% less breast cancer. It is protective against breast cancer. It protects you from breast cancer. Non-oral, because it makes your liver makes a metabolite that protects you. When you take it by mouth, it's different metabolites.
It goes through your liver.
Through your liver and everything.
Yeah.
Okay. So the ideal is to never go down. So I already have friends. I'm only in my mid-60s, falling and snapping, breaking something, who are not on their hormones. And I'm thinking, you got 30 more years to go easily.
Right.
I'm going to have to go to the
And
doctor.
so,
I'm making an appointment.
I know.
and
On
women
the way
have
home.
been, yeah, women have been,
Mackie and Meg segment?
Yes, yes.
What was your favorite segment? Can you pick one?
oh, absolutely not. I'll tell you. I'll summarize it this way. We did it for many years. Mackie Shulstone is in his 70s. He trained pro athletes to be number one, like Serena Williams,
still
people
in
like
touch?
that. Yes, very much so. Mackie's in his 70s, and he can do things his pro athletes can't do. And every day he's out there. He is defying. People have to stop thinking that age automatically means this. It's what you do with the age. And I learned from him. He used to say, because I grew up eating all the wrong food and the fat food and eating everything bad and doing everything wrong. The older you get and the more tests you have and look inside your body, you're like, I wish I would have taken better care of my joints. I wish I would have taken better care of, But skin, sunbathing, we now know how bad it is. But Mackie always said, don't rent your health, own it. Don't rent your body, own it. Because think about it, when you own something, you take much better care of it. And that just stood out.
Okay.
Yeah, okay.
What watch, do you have a favorite from that?
Oh my gosh, I have so many. So many. I mean, the list could go on. I won an Emmy recently for a man who lost his thumb, and he lost everything because he lost his thumb. He was a mechanic, and he couldn't grip anymore, and so he lost his job. And just like paving streets and stuff wasn't paying him, and he couldn't support a family, so he lost his home. And he got the very first 3D printed workable thumb in the world.
Wow.
And I got to go into the surgery and watch the surgeon do the implant with it. And why this is so important, and now he has his life back.
Yeah.
Why it's so important is because the Department of Defense is studying this for military amputees, arms and legs. Remember, it's not a prosthetic, it's not cosmetic.
Yeah.
It is workable, it can grip.
Wow.
And it was things like that. I get to go to work and do something, see something like that.
Close with the family.
My phone, now this is going to make me cry. Yes, I have a woman who was living in New Orleans housing development, and we were doing a story on that you couldn't smoke anymore in the housing development. And she went on camera and she was angry, how dare them tell us. Did the story, everything. But after I took my journalism hat, after we were done, I never let it affect my journalism. I pulled her aside and I said, what can I do to help? She'd been smoking for decades. I said, what can I do to help you? And I gave her the talk my father gave me at 5 years old about smoking. She didn't have a father to do that at 5 years old. And I said, there's clinical trials, free. We exchanged numbers, and I kept up with her. She called me. We keep in touch now because she had lost where she lived and had to walk through the floodwaters of Katrina, and still PTSD over that. And I told her every time I'm out covering a hurricane, I just get scared of losing my home again, and I get very upset. Every hurricane that's coming, I'm going to lose my home again, and I can't. At this age, I can't rebuild again.
Right.
And we talk, and I want you to know that this woman, she did it on her own, but she gives me credit. She calls me before every hurricane to see if I'm okay. She quit smoking. She had to have surgery. She would not have made it through if she was still a smoker. She owns her own home now. And I credit my dad because he put that in me, and I got to put Dad in her, and her whole life has changed. So one little 2-minute story about Hano changed its rules about smoking in the housing developments, HUD. Yes. I can dial her number right now, all these years later.
Oh, wow.
So yes, I don't forget, yeah. Because you have to understand, when you sit down with someone, you sit down with a man and he tells you everything about his erectile dysfunction, okay? There's a bond, because he's trusting you,
Yeah.
And so, and I find that most of these people go on and tell personal stories because they want to help other people because they were helped and they were miserable before. And that's how I feel. I want other women to have all the science so they have wonderful lives and feel as good as I do. I feel terrible sometimes, believe me, my hips and knees, but I just want women to have every advantage. Life is hard enough.
True. What about, okay, this one, wrinkle-free
Friday,
Fridays.
yep.
Got to give us some tips.
There's millions of things, and every time I go do a story on a new thing, because I was a horrible sunbather, horrible sunbather, baby oil, aluminum foil. When I worked the overnight shift, I slept outside on aluminum foil, which something just popped up the other day. I went to the doctor, I want it gone. It was mild dysplasia. You know, if I let it go, it could be melanoma. So every time I go do one of those stories, I say, will this work for me? And if the doctor thinks so, I'll try it. You know, from lasers to different things, different injections, absolutely, because I know, and this is something the dermatologists have taught me, most of what we call aging was sun damage, is accumulative sun damage.
I wish I could take that back.
You look under your arm, under your breast, your butt. It is not, you know, I wish my face was that smooth. Yes, and I have friends who never sunbathe because they couldn't, and they've never had. I'd have so much more money they've never had to have lasers and injection things that I've done. And I look, okay, this is what I would look like without the sun damage, and it's fine. I don't want to look 20. I don't want to be 20. Believe me, I really don't. I want to be me at my age without all the damage I did. I really mean that. There was a time when you think, oh, I want to, no, I really don't.
We have a game real
Okay,
quick.
game, okay.
Rapid fire.
Okay.
Okay, so really fast. Texting or talking?
Oh my gosh. Totally depends on the situation. No, but there is no answer. Talking, but in certain circumstances texting. But yeah, I can't stand people who text you something this long.
When they
I'm
could
like,
pick up the phone.
pick up the phone. Okay.
Yeah.
Talking.
Favorite day of the week?
I would say Saturday. Because I have the whole weekend. I have the whole weekend to do me.
Favorite city in the U.S. besides the one you're in?
Oh, wow. Wow, I didn't think this would be that hard. I'm going to go where my friends are and just say I went to Ole Miss, so Oxford, Mississippi. It'd have to be, to me, my favorite city is where my people are.
Yeah.
Okay.
My niece just started there.
Yeah.
Last song you downloaded?
This is terrible. It's that song where she slashes his tires because she's pissed off. Yeah, Carrie Underwood. Yeah.
Okay.
You know why? Because it's a good workout song. And I was working out to it. It's one of those where you can work out to it, not for any other reason.
Favorite holiday?
Christmas.
How long does it take you to get ready?
It can take an hour. A little less, but if I have an hour, everything's going to be right.
Okay. On a scale of 1 to 10, how good of a driver are you?
I have a heavy foot, and I'm always running late. I know y'all are surprised, and I like to get where I'm going.
Okay.
But I don't want to hurt anyone or hurt myself, so I don't take stupid risks. I would never do that. So,
What are you giving yourself?
I'm a cautious driver, but I can't stand when people.
I hear about a 6.
I can't stand when people don't get after it. They don't turn on right after they've stopped. You know what I'm saying? So I'm a legal driver, but yeah.
Fill in the blank. Taylor Swift is.
Oh God. A brilliant entrepreneur.
Oh.
That's all I'm going to say.
Okay. Is it wrong for a vegetarian to eat animal crackers?
No.
Big dog or small dog? I know you
Oh.
have dogs, right?
Oh, Molly Ann, I rescue German Shepherds and Louisiana Catahoulas, and they're in the 70, 80
Oh, okay,
pound
so
range.
big dogs.
Yeah. But
So-
not 150 pound dogs. But,
Okay.
oh, yeah. Substantial
It's
dogs.
always the
Yes.
big one. Scale of 1 to 10, how good are you at keeping secrets?
It depends. A real personal secret, good. But I think 100% of my friends would say I'm bad because I will tell stuff, but it's idle stuff I'm telling.
Yeah.
If someone has a very private thing, it's
So 10.
yeah.
Do you snore?
I've never heard myself snore.
Cake
But-
or pie?
Cake.
Do you believe in fate?
I think some things kind of meant to happen, but I think you have to take responsibility for your own life, and you make opportunities and put yourself in certain places. But does that make sense? Half and half. Half and half.
Yeah. Okay.
My mother used to say in her New Orleans accent, God helps those who help themselves.
We give you 3 wishes.
Okay,
What are they?
3 more. No. I could be like a beauty pageant and say, I really want world peace. 3 wishes. Obviously, I want happiness for everyone. In their families and the world. So happiness, peace for people. I guess that does sound so beauty pageant answer.
We get that one along a lot.
For there to be a discovery to regrow cartilage, because arthritis affects so many people, and I've done 1 billion stories on it, and there's all these things but no cure, and I understand all those patients now, who had knee pain. Final wish, how about like some food that I would never eat anymore, but that's really good, that's really bad for you, to be really good for you.
That's
I
a good one.
binge
So you
on
can
it
eat it as much
as
as you
whenever I
want.
wanted. Yeah.
Like ice cream.
Yeah, or decadence cake,
Okay.
flourless chocolate cake. Fat
Well,
and
cheers
sugar
to
and-
new friends.
Yes.
Cheers, friends. Cheers.
Friends and mimosas, thank you for watching this video. Please subscribe, like, comment and share just to